Let's see.
Hello, hello, everybody.
Is it? Oh, setting up you. It's not live yet. And let me go
Oh,
ahead
it's
and go
not. It
live.
says
Sorry.
there a little thing came up and said you're
Oh,
on.
oh, okay. Hello. Then we are live then. Hi, everyone. Happy Friday. Is it? Oh, it's not live yet. And let me go
Oh,
ahead and
it's
go
not.
live.
It says
Sorry.
there a little thing came up and said you're
Oh, okay. Then we are live then. Hi, everyone.
on.
I'm not sure if you heard that.
I did.
Okay. Let's see. Let's go live on Insta. We are now live on Instagram. So I'll wait for Dr. Q.
Okay, send me a
Send your request.
yeah. Here, I just sent you one. I
Okay.
sent you
Hi.
one.
Hello, hello, hello. Nice to see you. Hi, Macy Ella. How are
Okay.
you guys doing? Sorry, we're a bit late today. I had a meeting that ran over. All right. Who do we have here? Where are you tuning in from? Shout out your city. I want to know where you guys are coming from here. And let's see what our first question is today. Does anybody have a question to start us off? You got Montreal, we have Texas, Houston,
Costa Rica.
Detroit, Costa Rica, Brooklyn, hey, Wisconsin. No, I'm just joking. I'm from Iowa, so Milwaukee, okay. Tanzania.
Oh, wow. Welcome.
That's amazing.
South Africa.
South Africa, South Africa. That's awesome. All right. Let's see if any of all have a we got our first question here. What is your opinion on gene therapy? My parents are against it. Germany. Hallo.
Hello.
Wie
So,
geht es dir?
gene therapy is very effective. It's very safe because you use your own cells, and it's also very expensive. It's really sort of out of the ability of most people to pay for it, and we don't know if insurance would pay for all insurance would pay for it, but it's safe because you're using your own cells. So it's like a bone marrow transplant, except there's no risk of getting graft versus host disease, which is a big complication from um, having a bone marrow transplant. Um, there is a slight, very slight possibility of developing acute myelogenous leukemia from the conditioning part, busulfan. Um, it's happened in I'm thinking about maybe three or four people. Um, and that's a very difficult cancer to treat. Um, Otherwise, it's been extremely successful in many, many people. One of the things to think about is it's in its sort of infancy. So there's like nobody who's had gene therapy who is now 10 years out from gene therapy and it's still working and they're fine. And bone marrow transplant's been going on for decades. So you can say that if you do well with the bone marrow transplant, after a couple of years, you're set for life, really. But gene therapy, that's the hope is that it's forever, but there's not. They just there. It has to be years and years before you can actually figure that out. So I think gene therapy is, pretty monumental that you can cure sickle cell disease with gene therapy. What is coming up down the road, so one of the gene therapies is that increases fetal hemoglobin. It actually interferes with a gene that regulates fetal hemoglobin. And it turns out that a lot of people are working on ways to turn that off without the whole thing of gene therapy and chemotherapy and all that. It won't be available for 10 years or maybe even longer. But just to think about it, it's going to, just like science, as long as they keep funding it, just like science, things are going to get easier and easier and better. So that there are some uh, drugs coming down the line that will increase fetal hemoglobin by doing the same thing that the gene therapy does.
All right. Hopefully that answers your questions. I wonder why your parents are against it. That's my big question. And gene therapy isn't necessarily for everyone. Nothing is necessarily for everybody. Um, Hi Kiki. So the next question I have here is there something that prevents crisis?
Well, gene therapy is one. Um, uh, Readily available is hydroxyurea. Nothing besides like a bone marrow transplant, gene therapy, nothing is 100% effective in preventing sickle cell complications. So hydroxyurea is a medication that's been around for a long time. Lots and lots of people take it. If it is monitored by somebody who's knowledgeable, it can be very effective in decreasing your symptoms of sickle cell disease. And people have shown it's been used now for decades, and people have shown that those people who have sickle cell disease who take hydroxyurea have a longer lifespan. They have fewer complications, but it doesn't completely eliminate pain episodes. It's good at it, but it's not like 100%. So that's the one drug that's available now that's approved everywhere that definitely is changes the course of sickle cell disease. And someone's asking, there are a lot of new treatments in the pipeline for everybody who has sickle cell disease, older, younger. Usually when new drugs come out, they usually have like you have to be 12, 18 or something like that. And then later they do children. Um, but the trouble is, at least in this country, everything has to go through the FDA, and there have to be, they have to have phase one, two, three studies to show that what they think it does actually it does work. And then once they've shown that it's been effective in a number of people in these studies, then the FDA has to approve it. And in the EU, there's a equivalent to the FDA, which is a little more stringent than our FDA, and they don't actually always approve the medications that are approved in the United States may not be approved or even available in Europe.
All right. I have a question here. What's the life expectancy? of a bone marrow transplant, as opposed to taking hydroxyurea or another chemotherapy drug
Oh, you mean life expectancy of the individual
of the
who's,
individual.
yeah. So that's actually a very good question. Um,
And is there a study
once you've
surrounding that?
had, hmm?
And is there a study around that?
There are no study. I don't think anyone's gone head to head with the
Yeah.
study where some of the individuals get hydroxyurea and the other people get a bone marrow transplant or gene therapy or something that's considered curative. Um, but my guess would be that if you're your life expectancy might be a little bit better with gene therapy or a bone marrow transplant because those are really kind of curative. You don't really have any more symptoms of sickle cell disease. You don't have complications of sickle cell disease. Hydroxyurea does extend life. So um, I say this every time we're on, but Cassandra and I know somebody who's my age who has sickle cell disease, SS, and she's started hydroxyurea. She was on chronic transfusions and wasn't, she was your typical sickle cell patient. And when she was in her 50s, I guess, or yeah, she must have been in her 50s, she started hydroxyurea and she never needed another transfusion and she's doing very well. So part of what makes part of the issue with hydroxyurea is you have to have a provider who can monitor it, make sure you're on the right dose, change the dose if that needs to be done. But otherwise, hydroxyurea is something, yeah, everyone says it works wonders. And that's true for it's not doesn't work for absolutely 100% of everybody, but it works for the vast majority, 95% of people or more do well on hydroxyurea.
All right. Some really good questions here. I'm going to couple this with the another question about hydroxyurea. Two other questions. So one person asked, if I'm not taking hydroxyurea, will it affect me in any way? So maybe let's just start off with that. So if you're not taking hydroxyurea, how could that change the trajectory of
Well,
your disease?
sickle cell disease is different in everybody, and it also depends on what kind of sickle cell disease you have.
Mm,
Um, so if you're not taking if you have hemoglobin SS,
hmm
you can, and you're say 20 or something, 18, you're a teenager, and what's your history of it with sickle cell disease is going to predict what is going to happen in the future if you don't do anything. So, for instance, if you're 20, 18 or 20 and you had acute chest syndrome a couple times when you were a kid, you were in the ICU maybe once, um, you have other problems with your sickle cell disease. You have a lot of pain episodes, you have anemia. Those kinds of things predict that that's not going to change. That's going to go on through your entire life. And even with though we have new therapies, when you look at the entire population of people with sickle cell disease, the life expectancy is still less than 50.
yeah.
So, if you look at the entire population of sickle cell disease, and a lot of those people aren't taking hydroxyurea, the life expectancy really hasn't changed a lot since like the 70s.
And that's the disease as is with like n barely any treatment, correct?
Right. but it's a general, so when you look at the population, some percentage of that population is going to be taking hydroxyurea. But
Okay.
when you look at the entire
Entire.
population, like the mortality in California where we
Yeah.
live for sickle cell disease, it really hasn't changed that much for decades.
Yeah.
Um, and part of that is because not everybody has access to hydroxyurea and other therapies if you don't live near a center. Um, so if you don't take hydroxyurea, you can assume that your life expectancy is going to be shorter than somebody who takes hydroxyurea. Now, there are people who have what's called hereditary persistence of fetal hemoglobin, or they just have high levels of hemoglobin for some other reason. And so they're not sick all the time, or they haven't had really life-threatening complications. And those people will do better than people who say have had acute chest syndrome, their hemoglobin runs 7 or 8, um, and they have pain a lot. Those people should be on some kind of therapy for sure.
So one of the reasons why decided to start taking hydroxyurea was that it lowers your mortality rate. And that's what Dr. Russell Ware, and he's like the guy who knows probably the most about hydroxyurea within
Yeah.
sickle cell. And that was all I really needed to hear was that it lowers, and y'all know I have a 10-year-old, right? And I want to be around, I want to be her mommy for as long as I can. So when he said that, and I wasn't taking hydroxyurea at the time, or maybe I was, but I might have been iffy. I don't remember where I was in that journey. But that statement alone was like, okay, this is why I'm taking hydroxyurea. So that was my reason for why. Um, a lot of people have very valid concerns for not taking it, right? And my what I would say is just make sure you're informed. You never want to make a decision based off of, just a little bit of information. You want to have the whole story and then make a decision on, whether this is right for you. And so, and that's what I encourage just across the board within sickle cell is be informed about every single thing and then make a decision. I think a lot of us aren't given the information or we don't have the opportunity to understand the full concept or the full or see the full picture, and we're making decisions based off of a small amount of information, and that's not okay, and that's not our necessarily our fault, right? But I think just what we need to do as a community or as people living with sickle cell is we need to make sure we do our due diligence on our end, to make sure you really truly understand it. Make sure all stuff you hear about it is actually factual. They're not myths. We got to be fact checkers for our own health, right? Um, so that's how I got to that. I had, conversations, lots of conversations with Dr. Q, lots of conversations with other doctors and with other people taking hydroxyurea too. And that's how I came to that organ preservation. I didn't even start taking it because I wanted to be in less pain. I started taking it because I wanted to preserve my organs. And when you preserve your organs, you live longer. And so I was like, oh, well, that makes sense to me. And so that's why I started taking that. Um, There's another hydroxyurea question. Or one that's related to that. Somebody says, how do I remove yellow color in my eyes? This person drinks a lot of water, they take hydroxyurea, and they take folic acid, but their eyes are still yellow. So, um, what, how can you advise that particular person?
So I think what you have to do is make sure you're on the right dose of like I said, hydroxyurea does not work for everybody. So you need to vote to know that you're on the right dose of hydroxyurea. And by looking at your um, blood counts, a physician who knows about hydroxyurea would be able to tell whether the dose is the correct dose for you, whether it needs to be uh, increased a little bit, or whatever. Um, and hydroxyurea increases fetal hemoglobin. It decreases fetal hemoglobin actually decreases sickling, among other things. And so your hemoglobin goes up if you're on the correct dose of hydroxyurea. And usually hemolysis or red cell breakdown goes down. And what causes your eyes to be yellow is hemolysis or the breakdown of red blood cells. Um, so you should make sure you're on the right dose of hydroxyurea, um, that your blood counts are responding to it. And then there's the other reason why some people have yellow eyes, which is nothing to do with sickle cell disease, is that they have hepatitis. So if your hemoglobin is, higher than it was before you start hydroxyurea, if you um, don't have any markers of hemolysis on lab work, the next thing to do would be to see if you have hepatitis. Now, hepatitis is just means liver inflammation. So most people think, oh, hepatitis, that's like a viral infection or something, but that's not always the case. The other thing you'd have to, even though you're on hydroxyurea, think about how many transfusions you have, if you've ever been on chronic transfusions, and make sure you're not iron overloaded because that can also affect your liver function. So um, go to your provider. If they're a hematologist, they know all that kind of stuff, and they should be
Yeah.
able to help you out.
So there were some follow-up questions with the hydroxyurea. What's the dose to be taken for hydroxyurea? So this is based off of your weight, and this is based off of you personally. So not everybody takes the same dose. I have
Right.
a sister with sickle cell. She takes a different dose than I do. So that's based off of, your weight, and it really is half of the battle. Like, some people say they hydroxyurea doesn't work for them, and that's because they're given the wrong dose. So dosing is actually very, very important with hydroxyurea. So that answers that question. Um, how long does it take for hydroxyurea to take effect? It's one of those drugs that takes months, months. Am I right, Dr.
Yeah, it
Q?
takes, I would say you might see your blood counts changing in 3 months or so, but you won't see personally an effect for about 6 months because you're increasing your fetal hemoglobin. Your bone marrow has to make some changes in order to do that. So all that takes time. And people say that uh, you should see an effect in 3 to 6 months. And then if you don't, the person who's prescribing it can look at your count and tell whether or not um, there are some changes in your counts to tell whether or not they can increase your dose a little bit.
Yeah. Um, so one last follow-up question with hydroxyurea, and then I'm going to go to the sickle beta thalassemia question. Um, my son is 9 months, has never had a crisis before, knock on wood. Do you think it's okay not giving it to him? And I'm guessing giving it to him means hydroxyurea.
Mhm.
Um, to him right now, I don't even know yet what type of sickle cell he has. So, this person, you should already know what type of sickle cell he has at 9 months, right?
Oh yeah, you should,
Yeah.
depending on where you are, I don't know where that person is, but
If
here
you're in
in
the
the,
US.
oh, well, you should have known with newborn screening. So
Yeah, so
newborn
that's what I was
screening
saying.
is,
If she's in the US, I'm not sure where this person
yeah.
is, but
If
if they're
you're
in
in
the
the
US,
United States, everybody in the United States now gets newborn screening, but it's a pretty simple test. It's, called hemoglobin electrophoresis. There are more fancy tests, but hemoglobin electrophoresis is a pretty simple test, and it can tell you whether or not you have sickle cell disease and what type it is. Um, and there's, the most common is SS, probably the next most common is SC, but then there's a lot of variants. So there's S beta thalassemia, which can affect your, which is another variant for sickle cell disease. But then there are a lot of other different variants. So you need a diagnosis before you do anything like start a medication for sickle cell disease. You have to know what kind it is. You may not, if you don't know, it could be that your child doesn't have sickle cell disease, they have sickle cell trait. I
and that's what
mean,
I wanted to say. You're right in saying this person is right in saying, you don't if you don't even know what type your son has, not to give him anything. So that's really good intuition on that. So the first step would be to confirm his diagnosis to see what type of sickle cell disease, because hydroxyurea may not be appropriate for everybody. And then, you look at the genotype and, they may have quote unquote a milder one. Of course, it's on an individual basis and may not need hydroxyurea. This person could have, as Dr. Q said, persistent fetal hemoglobin, where their fetal hemoglobin is already very high and they may not need hydroxyurea. So there's a lot of instances where somebody may not need hydroxyurea. So getting a diagnosis is very important first and foremost. So um, I'm glad that you use discernment on that. The next question I have is, what about people with sickle beta plus thalassemia? Do you know people? Do you know people with this form of sickle cell? I do. I actually know a couple people with this sickle cell, and just so you all know, there's honestly one, two, three, four common types of sickle cell, are more common, right? SS is most common. SC is second most. S beta 0 and S beta plus is third most common within sickle cell. And then you have more rarer types of sickle cell afterwards. So there are a lot of people with beta thalassemia out there, sickle beta thalassemia out there. And I personally know a couple with S beta plus as well. Do you have anything to add to, like, anything, any
well,
context?
S beta plus thalassemia, S beta zero thalassemia means you have a mutation of your hemoglobin that where you don't make any hemoglobin. So someone who has that would be one of your parents would have uh, thalassemia trait with S beta zero with a trait that didn't make hemoglobin, and they would be anemic, and probably as a kid somebody may have told them they needed iron or something like that. And they would be able to know whether or not they had S beta zero thalassemia. And those people, if their children, if you're with a partner who has S, that's S beta, and you get S beta zero thalassemia, that's equivalent to hemoglobin SS, S beta zero. S beta plus thalassemia is kind of a range. So plus means that you do make normal hemoglobin but and that's what the plus means, but you don't really know how much. And it can be extremely low so that you have a lot of symptoms, or it can be a little bit higher where you have fewer symptoms. So I've seen children who have S beta plus thalassemia, but they have a lot of symptoms because they don't
Yeah.
make very much normal hemoglobin. And other children who have S beta plus thalassemia make more normal hemoglobin, so they have less, or they have a lot less problems. Um, and so it's a range, and it's difficult to predict what's going to happen with a young child, how that is going to affect them in the long run. Um, and I think with S beta plus thalassemia, you would have to see what the course the of the disease was, and then decide whether or not um, hydroxyurea or some other therapy would be effective. And that's a possibility. It's been shown recently they've um, developed mice. Well, mice are what scientists use to test drugs and other therapies for sickle cell disease. And there are mice who have human hemoglobin that's SS. And in the past couple of months, I guess, or a year, and I don't think it's been a year, they have now a hemoglobin SC mouse. And using that model, they've been able to show that SC does respond to hydroxyurea. And if you have SC and it's symptomatic, it would be one therapy that would you could consider would be hydroxyurea. In the past, when it came out a long time ago, people just didn't. They just said, you have SC, you don't sort of qualify for this drug. But recently, and this very recently, people have started to realize that yes, some people with hemoglobin SC could do much better on with hydroxyurea. It would actually work.
Um, to follow up with that question, can thalassemia patients take hydroxyurea?
Could people with thalassemia?
Thalassemia.
Uh, a thalassemia doctor, some people, depending on, and the thing with thalassemia is, again, there's about 250 different mutations that lead to thalassemia. So depending on your mutation, it depends on the severity and then whether or not hydroxyurea might work. And theoretically, hydroxyurea should increase fetal hemoglobin, which would increase your total hemoglobin. So if you were transfusion dependent, meaning you you don't make any hemoglobin, uh, hydroxyurea might help, but it would have to be tried out to see if it raised how high your fetal hemoglobin went on the therapy, and it might decrease the amount of blood that you received every month. Um, but it wouldn't probably would not like get you off of transfusions if you had if you had beta zero thalassemia. So
Okay. Um, Hopefully that answers your, and I just learned something new, 250 mutations within thalassemia. I
at
had no
least,
idea.
yeah.
Wow. Um, this next question, I'm having a chronic chest cough and vomit feelings a lot, almost always in the mornings. Is there something I should be doing with my liver or digestive system as it pertains to sickle cell?
Well, I think um, if my impression here is this person has a cough and it causes them to vomit in the morning usually,
They
right?
have a chronic chest cough, so they cough
Yeah,
like almost every day, a chest
right.
cough, and then they have well, they call it vomit feelings, but I'm guessing that's nausea
Yeah.
a lot. So a nausea can happen in sickle cell a lot. I'm not sure.
Yeah.
What do you think?
Yeah, I think the first thing to do is figure out why you have a cough.
Yeah.
You shouldn't, chronic coughs mean, a chronic cough can mean that you have some respiratory problem, or maybe you have what's called reflux, where your contents of your stomach go up into your esophagus, the tube that goes from your mouth into your stomach, and that can be irritating. And you can actually irritate all the way up, so it causes you to cough, and that would because you have this GI problem that might lead to vomiting. So I think you need to go go to a GI, gastrointestinal doctor or your provider and talk about those symptoms to see maybe you need some medication for what's called gastric reflux, and that's causing your cough, or maybe you have another reason for your cough. And the coughing could be so, I don't know how bad but coughing can increase the pressure in your below your diaphragm and actually make you vomit if you're coughing hard enough.
All right.
But that's
Um,
that's a go to your doctor uh,
let's go to
answer.
your
Yeah.
doctor. Um, and then also chronic, just keeping them in your frame of mind that, these things can happen outside of sickle cell too. So
Right.
um, this could be sickle cell related, but equally it might not be. So it's important for you to remember that, but also your provider, because I think providers, once you have that sickle cell diagnosis, a lot of times they like to lean on that diagnosis and say, oh yeah, this is sickle cell. Oh yeah, this is sickle cell. So just making sure that you're thorough about this, right? And making sure that it is a sickle cell thing, or confirming rather this is a sickle cell thing or it's not a sickle cell thing, because I think coughing and nausea could be a lot of other stuff too. um, of course it could be sickle cell related too, so just keep a open um, frame of mind when you're approaching this conversation with your doctor, and keeping all options open. My son's hemoglobin is always on the 7 range. So would it be okay to start hydroxyurea even if he hasn't had a crisis?
I don't know how old he is, but yes, it wouldn't be fine to start hydroxyurea. Hydroxyurea, in some cases, hydroxyurea is given sort of, I guess you'd say, prophylactically, and they start in very young children so that they never have, so that you decrease their symptoms over their entire
And
lifetime.
prophylactically means like preventative, like
Yeah,
you're
preventative
taking it,
care.
you're not reacting to something, but you're taking it so that problems don't happen along the way.
Right. So it's been shown that children who start hydroxyurea at a young age have they have decreased risk of stroke, they have fewer complications of their sickle cell disease, um, and they just generally do better. So the other thing that happens if your son has very low hemoglobin is that you increase fetal hemoglobin, which increases your overall hemoglobin. So, you can't tell until you start the medication, but it could increase his hemoglobin to 8 or 9, maybe. It wouldn't make it really high, but it could increase his hemoglobin. Um, and then again, like we were saying, it takes 6 months or so to really get the full effect of the hydroxyurea. And during that time, he'd have to get some blood tests done to see, because he's a little person, to make sure that the dose was right and he wasn't having side effects from it.
Sorry guys, I'm getting to your I can't hear you comments. I I I try and go on mute while I'm typing because my nails are really loud and I don't want to disrupt you guys hearing what Dr. Q is saying, so sometimes I forget to unmute. Um, so yeah, there what I mean, most hematologists would advise to start on hydroxyurea as early as possible, to prevent, and the way I think about this is, you know, you're the older you get, sickle cell is a progressive disorder, right? So the older you get, the more damage sickle cell does on your lungs, right? And I think just, any normal person, the older you get, your your organs become damaged, right? But with sickle cell, it's at an accelerated rate. And so with hydroxyurea is slowing that down. So if you start earlier, then you have less damage. So for example, like me, I was hard-headed. I didn't start hydroxyurea like right away. And I'm sure Dr. Q told me like a whole bunch of times, but I was just trying to live my life, right? And and not take medicine for the rest of my life. Um, but finally, I got sick and even though I'm feeling good, I'm still sickling. Even if I'm not in crisis, I'm still sickling. That damage is still happening. And so once I really understood this, and it took me a while to understand this because a lot of the focus with sickle cell and a lot of the education growing up was pain focused, right? And it was pain and like, what can we do with the pain? And the pain was traumatic. But there wasn't a lot of focus on the hemolytic anemia side of sickle cell. And that's kind of like the silent killer, if you will, where, there's this damage happening behind the scenes. It's not something you necessarily feel. I think a lot of us think we only have issues with sickle cell when we're in pain, but that's not true. And so I feel like, we need to know as a community that sickle cell is still sickle celling when you're not in pain. And so, how do you slow that process or how do you slow that damage down, that sickling down? One way to do it is through hydroxyurea. So, um, hopefully that provides context as to like, the sooner you on it, the sooner you're slowing down the damage of sickle cell, if that makes sense. So and it's never too late to start hydroxyurea. If you haven't started, if you're like hearing this for the first time and you're 65, you can still start hydroxyurea, right? But the sooner the better. Y'all really want to talk about hydroxyurea today? Okay, I have another hydroxyurea um, question here. I'm 19 years old with sickle cell SS, and I started hydroxyurea, been on blood transfusions my whole life. Um, Oh, okay. I'm sorry. That was just a statement. But the statement is I'm 19 years old, started hydroxyurea. I've been on blood transfusions my whole life, and I've been having loads of side effects. Maybe.
Uh, there are side effects to hydroxyurea, but there's not, as far as in my experience with patients, there's not loads of of different side effects. That people complain um, sometimes about hair loss, but it's very some people are just, I guess, more cognizant of it. I've never seen anybody lose so much hair. I could tell they were losing hair on hydroxyurea. Um, and can be hematological side effects where you feel okay, but the doctor can tell from your complete blood count that there's problems. So it's hard to tell uh, whether the side effects you have are secondary to the hydroxyurea or something else. If you've been on blood transfusions for a long time and you have not been chelating, then the side effects could be from iron overload. Yeah, someone says I've never had hair. The side effects for any medication, the list that you see is for every side effect that every person ever had, which can be 10 people, 1,000 people, or 50 people. So you may not have any or more than one of those side effects. Um, they're just the possible side effects. Some side effects are very common and they would be kind of at the top of the list, but There's a lot of side effects to all medications. Everything you do in medicine, there's side effects.
And that's where you have the discussion, do the benefits outweigh the risks? And that's very
Right.
personal to you, right? And you have to think about what does a high quality of life look like for you, right? Some people, if taking medication is the worst thing in the world to them, then maybe taking hydroxyurea isn't the best thing because it lowers your quality of life, right? And some people, they care more about hair or they care about this. So for me personally, when I learned about, the hair loss and the nail discoloration, I saw those as more cosmetic type of concerns, which I mean, I'm a bit vain, but not that much maybe. I don't know. Maybe I am. I don't know. But to me, those were easy fixes or easy problems to solve. Like, and the way I reasoned with it was, I can live without my hair, or I can live with, ugly nails, but I can't live without my organs. So I need my heart to be working right. I need, my liver, my kidney. I need all of that stuff to be working right. And if I ended up having that hair loss, I can do braids. I can wear a wig. I can do, there's things I can do around that. If I have ugly nails, I can get them done. I need to, don't look too closely. I need to redo my nails. But, and that's not applicable to me, right? So I don't have hair loss. I do have like the nail stuff and it gets worse sometimes and it's cool sometimes. But I just get my nails done because I like getting it done. And if it covers up some of those hydroxyurea lines, so be it. So it really is, you deciding, you looking at what is important to you, and then looking at the benefits and the risks of, these medications and figuring out, um, is hair loss something, is it a deal breaker to you? Is, organ protection, is that one of your priorities? And just understanding. And that's why I said earlier, you have to have all the information to make these decisions. You cannot have a piece of the information because then you're being misled, right? And so making sure you fully understand um, whatever is being presented to you is part of, advocating for yourself for the best life you can have with sickle cell. So that's my 2 cents on hydroxyurea. How does it cause, how does hydroxyurea affect infertility? That's a question we get a lot.
Yeah, so in men, well, people with sickle cell disease, you're sickling everywhere in your body where there's blood. So people who have sickle cell disease, women go into menopause earlier than women who don't have um, sickle cell disease. So it affects your ovaries and your hormones. Sickle cell does by itself. And men with sickle cell disease have lowish sperm counts compared to people who don't have sickle cell disease, which doesn't mean you're infertile. It just means your sperm count is a little bit low. And if you take hydroxyurea, your sperm count can be a little bit lower still. But again, you're not infertile, you just have a low sperm count. Um, and if you stop taking hydroxyurea, then your sperm count goes back up to whatever it was before you started taking it. It takes a while, but that can happen. So people recommend that men and women who are intending on having a child don't take hydroxyurea during that time because nobody knows whether or not hydroxyurea would affect a baby, although there have been plenty of women who took hydroxyurea in the first part of their pregnancy, which is usually when bad things would happen if it was a teratogen. It is a teratogen, but not a bad teratogen. Um, and so that's an issue. And in men, if you stopped hydroxyurea, say because you were planning on having a child, that would increase your hemoglobin or your sperm count back up to whatever it was before. So it's reversible. So it's not permanent. It only happens um, while you're taking the medication. And they've also looked at, well, what if you start hydroxy really early? Does that cause you to have a problem? And the answer to that is no. The people they've studied uh, who were teenagers or younger, as they got older, if they stopped the hydroxyurea, their sperm count went back up again. So hydroxyurea never makes you sterile, meaning you can't have a child. It decreases your sperm count. Um, and I've never actually seen, quantitative a study that quantitated that. So I don't know if it's and it may differ depending on the dose of hydroxyurea you're on. But I've never seen like numbers about your sperm count on hydroxyurea versus off your hydroxyurea. I've not seen that in the study. They just say your sperm count goes down.
And I think it's important to also remember, and reason I know this is because we work with a group called SC Red, and it's the Sickle Cell Reproductive Education Directive, right? And so they specialize in reproductive health within sickle cell. And without hydroxyurea, as Dr. Q said, sickle cell impacts every part of your body, which includes your reproductive organs. And so it's part of the reason why you might see people going into menopause earlier within sickle cell, but also, you might see lower sperm counts just as is within men with sickle cell without the hydroxyurea. So we have to remember sickle cell impacts every single part of our body, including reproductive organs. And there are effects surrounding sickle cell with reproductive organs, long story short. So, um, and then that would be maybe another reason why somebody might start taking hydroxyurea to lessen. And I'm not sure if there are direct studies on how hydroxyurea. I'm sure there are actually. I'm not aware of, and I'm not sure if you're aware of the Dr. Q how high hydroxyurea impacts like just reproductive organs, outside of sperm. Um, but yeah, there's definitely studies out there, and if you all are interested in the reproductive, um, just story of sickle cell, like I said, there's a really great group. It's called SC Red, sicklecellred.org, and they do an amazing job of breaking that down. Okay, so this we talked a little bit about life expectancy earlier with sickle cell, and so when Dr. Q, you said life expectancy is under 50 within sickle cell. That's across all genotypes?
No.
Or yeah,
Yeah.
okay. This person asked right here, is it right that people with sickle S beta plus thalassemia don't live more than the age of 60? Are there people which get older? So we know a couple people who are 70s with sickle cell. So personally know people within 70s of sickle cell. I think even maybe 80. I personally know somebody. And then I've heard stories of people who are like 90 with sickle cell and in Africa and some of these other places. And so we are living longer. It's not a problem, right, to live longer, right? But it's a gap that is emerging within the space because we grew up getting expiration dates, right? And so now that people with sickle cell are living longer, there is that need for support for those who are aging with sickle cell. And so it's a big gap within the community currently where you know patients are living past a certain age, and that requires specific care, right? Yeah. Like we have pediatric care for sickle cell. We need to have, geriatric care for sickle cell as well. So people are living longer, but as a whole, that statistic hasn't increased, which is a problem. And so I think last time I read it was 42, but I'm not sure where that number is now. And this is what we're working at we're looking at as a community to increase that number, that life expectancy number, and but people are living longer. Long story short, so don't let that statistic discourage you, or don't take that on, right? People are living longer with sickle cell. Care is getting better. We're going to have more options in the future as well, which will elongate that life expectancy.
Even and many of those people are on some kind of therapy. They are on hydroxyurea or whatever. And then when people look at, depending on the study, when people look at the life expectancy for sickle cell, they might include SS, SC, or S beta thal. So you don't really, um, it's that number doesn't apply to an individual. It's the whole population. So it doesn't, don't feel like it applies to you personally.
Yeah. All right. I've been having pain in my hands and feet. They told me it's an episode, but I never dealt with before, and it's giving me a hard time. Any suggestions? So it sounds like it's an episode, having pain in your hands and feet.
Um, you know, even adults can get dactylitis, which is what children get when
Yeah.
they can have pain in their hands and feet and they're swelling. And in little kids, it's pretty striking. Um, and so that's not completely off the table. So you could be having dactylitis in your hands and feet. That's not in sickle cell disease, that's a possibility. But if you've never had it before and it's just starting, then I think your provider needs to make sure that it's sickle cell disease and not some kind of other problem, um, like an autoimmune disease or some kind of vascular problem. Uh, like Cassandra was saying, both doctors and people with sickle cell disease tend to blame things on their sickle cell disease when really it could be something else. Um, myself included, you kind of wish and hope that, well, I have sickle cell disease. That means I can't get anything else, right? Because I've already got sickle cell. I can't have something else on top of that, but that's not your the probability of you having some other problem is the same as the general population. So if you don't take care of yourself, you could have heart disease, hypertension, all that kind of stuff. And in fact, that there was a study that showed that even though we have transcranial Doppler and which can which can predict stroke so that there can be a intervention so that you don't have a stroke as a child. The in this was in California, the incidence of stroke doesn't hasn't really changed that much. Partially, I think, because people aren't doing transcranial Dopplers the way they should, and also because they're not treating what would be considered in the general population risk factors for stroke, like hypertension and cardiac and some other problems, obesity and stuff that can contribute to stroke. So if you have sickle cell disease, your blood pressure is usually a little bit lower than normal. And if it's a little bit higher than normal, that maybe physician wouldn't completely think, oh, that's off the hook or something, that as your blood pressure goes up, your risk of stroke increases. And if you have sickle cell disease, like Cassandra says, the sickle cell disease is affecting your body all the time. So I've never read this, but um, you have to wonder if you have hypertension, is your risk of stroke higher than another person without sickle cell disease that has high blood pressure? And my sort of intuitive, uninformed guess would be that yes, if you have sickle cell disease and you have high blood pressure, your risk of stroke is probably a little bit higher than someone who didn't have sickle cell disease and had increased blood pressure. And someone says, I have high blood pressure. Well, you need to be treated for that. And people with, like I said, people with sickle cell disease, their blood pressure, because of their anemia, et cetera, their blood pressure is a little bit lower than normal. So a little bit higher blood pressure would be more significant in someone with sickle cell disease than somebody who didn't have sickle cell disease. And it should be treated to prevent, basically to prevent stroke, heart disease, that kind of stuff. Just like, just like people who don't have sickle cell.
Just a follow up to the previous question. Somebody says to the person who asked this question, I am 60 and I personally know someone who is 71. So there you go, guys. Um, we're out there. I said we're. Um, but yes, there are definitely people living with sickle cell to a big age. Um, I have a question here. I'm going to couple it with another question. Somebody talks about, so someone says, my daughter suffers from the disease and has never had a crisis since she was born. She's 4 years old now. Is that normal? Somebody else says, what if you've never had a crisis before? I've never had one and I'm 19 years old. So, um, what do you say to that, Dr. Q?
Well, for the 19-year-old, I would I would make sure my diagnosis was what you think it is. You could have S beta plus thalassemia, and that wouldn't be entirely, um, it would be a little unusual, but not entirely unusual. You could also have something in California. We have people who have what's called SE disease. Um, and those people technically have two hemoglobinopathies, but people with SE disease don't really tend to have any problems with their sickle cell. So um, you it would if you're curious about that, and I would be if I was 19 and someone
Yeah.
told me I had sickle cell and I'd never had any problems, I would be retested. I mean, they go to great lengths to make sure that the diagnosis you get when you're a baby is really your diagnosis. So in California, you get screened, and if you have hemoglobin, if you're screened as having sickle cell disease, then when you're 2 months old or so, you go to the sickle cell center and they retest you just to be sure that you really do have hemoglobin SS or whatever. And I think someone said I have SS, and is this the person maybe who's 19? You could also
I
have really
wonder.
high, you could have hereditary persistence of fetal hemoglobin,
Right.
which would also, make it so that you would not have problems with your sickle cell. But I
And
think
that's,
if you're in your late teens or 20s and you've been told you have sickle cell disease and you've been told you have SS, then if you're kind of curious like I would be, you would want to have somebody make sure that that was the correct diagnosis and that what's my fetal hemoglobin, there's a reason for that.
yeah.
And I think I think it's part of your health history is to know, what your hemoglobin actually is.
Yeah. So,
And someone says I was 32 and I had my first crisis at 18 and I have
wow.
SS.
Yeah.
So, yeah, that can happen. Most people with sickle cell hemoglobin SS have problems starting, you know, like what we all think in the early uh, childhood.
Yeah. Consider yourself lucky if you do
Yeah,
in fact and ride that out. Don't change a thing. Do whatever you're doing, continue to do it.
right.
Um, yeah, so but
And
yeah,
it's hard to say, you could not have any problems until you're 18 or 19 or 20, and then all of a sudden have problems.
yeah,
So even though you haven't had problems, like Cassandra says, depending on the other things, whether they're, fetal hemoglobin, et cetera, you're still having sickle cell changes in your body somewhere.
yeah.
And I mean, I would be if I was in my 20s or whatever and didn't, and was told I had sickle cell SS or whatever, I would just be curious to know why I wasn't having problems. Just
I,
out of curiosity. It wouldn't change anything. I'd just be curious
yeah.
to know that.
I had a streak as well, where I was like, oh, do I? So I diagnosed with SS, right? But I hadn't had any type of complications. Now, my childhood was different. It was opposite of that. I was in the hospital probably on a monthly basis. But then there was a span where I want to say I was in my late teens, early 20s, where like I didn't have any issues with sickle cell. And I was even thinking to myself, do I really have SS? And like, I was just like, wow. And it was around the college years too, so like that was great for me too. And it's probably because I got such great care from Dr. Q. He sent me on my way, right? So there are there are some times where people have like a span of just sickle cell being very uneventful, in terms of you having crisis or you having pain or you being in the hospital. So that can be a thing as well. And then also just for me personally, my sickle cell, I think the last time I've been hospitalized for sickle cell was 2017. So while I know I have sickle cell and I know I have SS, and that's because of like the daily pain, right? But because it's manageable at home, and I can, it's not as severe. Um, I'm able to manage it at home. But by the same token, I haven't been hospitalized since 2017. And when I was hospitalized in 2017, it was because I was on a trip to Indonesia and I got really, really sick. And so that was a circumstance in which, I put my body in an extreme circumstance, and that's why I got sick. Before that trip, I hadn't been hospitalized in 5 years before that. So it could just be your sickle cell. Sickle cell presents in so many different ways. Like you meet one person with sickle cell, you meet one person with sickle cell, regardless of diagnosis. So while there are common complications that happen within sickle cell, it doesn't mean that that's your personal trajectory. And you might go, years and years and years without even a crisis, without even pain, and you still have sickle cell. But it's still worth, if you're going through one of those periods, it's still worth being followed by your hematologist, because a lot of times with organ damage, you don't feel anything with organ damage, and you don't know until oftentimes it's too late. So you still need to be followed by a specialist, even if you're not experiencing anything, so that we're making sure your organs looking right, making sure like everything just looks good, right? So
And
that's what I'm saying.
I think, the recommendations for sickle cell disease from ASH doesn't sort of downplays screening a little bit, but I'm a pediatrician,
Mhm.
so I'm really big on screening. So I think even if you don't have any problems with your sickle cell disease, like you're 19 and you've never had a crisis or any kind of problems, and you, like Cassandra, you're sure you have hemoglobin SS or some other type of sickle cell disease, I think you still need to be evaluated by your physician. So you still need to get your eye exams to make sure you don't have retinopathy. You might um, want to have your hemoglobin tested. I mean, not, once a year or whatever, just to make sure. And maybe your anything else that might be going on. But there are, like Cassandra says, things are, even though you may not have a pain episode, things are happening because you have sickle cell. And hopefully, that's going to last the rest of, you're never going to have a problem with sickle cell. But
Yeah.
um, I wouldn't drop my guard down too much if I went through a period of time where I was older and I'd never had a problem with sickle cell. I think the other thing is, I think really part of it is your lifestyle. So if you have a really good diet, you drink a lot of water, you take care of yourself, you exercise, I mean, all those things are going to affect your sickle cell disease. And if you take really good care of your health, especially your diet, and you, it's going to affect, it's going to make you feel better. And there was a study a long time ago in, I think it was in the Middle East, and they showed that people who they grouped people who had a very poor diet versus people who had what they considered a good diet. And the mortality, not the complications of sickle cell, but the mortality increased in people who had a very bad diet. So diet is really, really important, and hydration, exercise, those things are going to make you feel better. And if you're a teenager, you're still you're young and you can do all that. You can exercise and do things. You can't overdo it, and you don't want to get dehydrated. Those things could really exacerbate problems if you do that.
Okay.
The
And
other
someone,
thing is, just to throw this in, is siblings can have totally different types of people with the same parents can have completely different presentations of their sickle cell disease. So there are things that we have no idea what they are. At least I don't have any idea, and I've never read anything that affect your sickle cell disease. And if it would behoove people who are scientists to try to look at, do a study of siblings that had different courses of their sickle cell disease, and what's the difference between the two? Is it fetal hemoglobin? Is it some other thing that could be part of a treatment for sickle cell disease? And that's why one of the siblings does much better than the other one.
and I'm seeing here in the comments like all the variations. I'm 21 and I've had three crises. I have sickle cell and I have heart problems. Um, I have a lot of health problems that I've just never had crisis. So that just shows the a diversity in what sickle cell looks like in a lot of us, right? And so while I never go to the hospital, I'm in pain every day. I have chronic pain, and my sister who goes to the hospital often, hopefully like, in between she doesn't have the chronic pain, but it's just it's different. And on paper, we may all look the same, like, where they write genotype SS, but in reality, we are all so different. And, sickle cell presents differently. And like Dr. Q says, it's not just your DNA, it's your environment, it's your stress levels, it's your lifestyle, it's your what you're eating, It's all of that. So sickle cell, you have to look at it in a holistic way and not just a medical way. Um, so yeah, keep that in mind.
Although food is medicine, right?
I love that. I love that. Food is medicine, and you know, I think we did some sort of readout or share out of that study that you talked about. And I think it was in Saudi Arabia where
Yeah.
it shows, if you have a high nutrient diet and you start early, right? I think that was another point of it was you started early. Those who had a high nutrient diet and started early had better outcomes with their sickle cell versus those who did not. Now, it's the same thing as like hydroxyurea. It's never too late to start eating well. It's never too late to, start caring about that, right? But the sooner the better, always with a lot of these things.
And in that study, everybody was about the same age. They all lived, that socioeconomically, they were all about the same, but some people just had a crummy diet, and so yeah, it makes a big difference.
Yeah, it's really cool to see studies, especially within those regions, because socioeconomically everybody's the same, right? Whereas in America, there's just you know such a diversity in that, and so um, this in this particular study within Saudi Arabia, everyone had access to care, sickle cell care. Everybody made around the same amount of money. Everybody had the same around the same amount of support. So whereas you look at societies like here in the U.S., that's not the case. So it's always interesting to see studies coming out of that. Um, okay. Let's take a couple more questions before we wrap up. And I'm still catching up, but thank you guys so much for the wonderful questions. I'm still getting through a lot of your comments here. And it's a lot of people who have been saying they haven't had crisis or they haven't. And good for you guys. Good for you. Maybe this is next gen sickle cell here. I don't know.
I
Um,
think also people are more health conscious nowadays and they
mm,
have access
yeah.
to a good diet. So that definitely, I mean, we're all healthier. I mean,
Yeah.
I'm going to be 80, so I look pretty good for 80, actually.
Ah!
But it's because, you live in a place, you get exercise, you have a good diet, and yeah, we're all fortunate that we've had that opportunity to be healthy.
Yeah. Information is power in this day and age, right? And so, like that, like I said earlier, guys, you need to know everything, right? Information is power because information is literally the reason why people die with sickle cell.
Yeah.
Whether it's on the doctor's side or if it's on the patient's side, it's literally the reason why children are still born with sickle cell because people don't know their genotype. They don't know what the chances are if two people with this, like information is so important and really changes the trajectory of what your disease could look like. So that's why I'm really pushing for like, education and this is why we Sickle Cell 101 is what we are today, right? We believe information is a right for people and, have all the information and then make the decision. And, there's no right or wrong way to do this. Just have all the information and then choose what's right for you. I'm gonna scroll all the way down. I see somebody says 80. Is somebody 80 here?
I'm
Oh, oh, oh,
78.
okay. We're talking about Dr. Q. And yes, he does look amazing. Um, Dr. Q, I didn't know we were rounding up here. Uh,
Sometimes I feel like I'm 80, but I'm not quite there yet. I'll be
Sometimes I feel like I'm
79
80.
this year, so
That's amazing. Um, I I have two children with sickle cell SS, excuse me, and they have totally different symptoms. Yes. one high hemoglobin and one has low hemoglobin and is on meds. Should the one with a high hemoglobin be on hydroxyurea also? That's a great question.
Oh, yeah, hemoglobin, sure, yes, if you have sickle cell disease, then you should be on hydroxyurea. Um, and the reason is that even if your hemoglobin is high, the well, maybe maybe one of your children has high hemoglobin to begin with, high fetal hemoglobin to begin with, inherited that from your one of the parents. But even if your hemoglobin is high, you still it's all hemoglobin SS. So hydroxyurea will slightly increase that person's hemoglobin because of the fetal hemoglobin, but also fetal hemoglobin interferes with sickling. So little kids they have brand new little bodies. They haven't had sickle cell for very long. And so they do much better than people who are older. So I think, and I think a lot of other physicians would say that even though your hemoglobin's a little high and you haven't had any problems with your sickle cell and you're younger, you should consider starting hydroxyurea. I mean, I think if maybe your child is doing really well and you have some time to think about it, but I wouldn't wait to have them have problems before you started it. Back in the day when I gave people hydroxyurea, I used to, in little kids, I'd say, well, they're doing really well. Let's wait until they have a pain event or something like that to start hydroxyurea. Um, but over time, I changed my mind about that and felt like, well, why should you wait for something to happen? If you think hydroxyurea is helpful for people who have sickle cell disease, why not start it before they have any problems? And this was before bone marrow transplants were as safe and effective as they are now. Um, and I used to tell my uh, parents, start hydroxyurea because you never know. Maybe sometime in the distant future, they will have gene therapy and you will be healthy enough to get that therapy, or you'll be healthy enough to get a bone marrow transplant. So you want to stay healthy for as long as you can, and hydroxyurea helps. It's not a miracle, but it does help a lot. A good number for a hemoglobin would be um, in sickle cell like 9,
So
10.
I just came back from a thalassemia conference. And I know this is thalassemia, it's not sickle cell. And they said that number was 10. Is like your hemoglobin should be at 10, and this could just be for thalassemia again. Where, anything below 10 is where you would still have complications, or you would have serious complications, anything below 10. I wondered, I saw that question. I wondered, is that the same for sickle cell as well?
Well, the higher hemoglobins in sickle cell disease don't I don't think they equate to be doing better. But in thalassemia, if they don't have anything, they have normal, when they're transfused, they have normal hemoglobin. But usually, if your hemoglobin is 9, not between 9 and 10, you don't really notice, you don't, your level of fatigue and other symptoms kind of are not there. So whether your hemoglobin is 10 or 12, you don't really notice the difference. But if your hemoglobin is 7 or 8, that you notice that you have more fatigue, you're tired more, your energy, your ability to do exercise is less. So that's why they say around 10, most people can't really tell the difference between, say, 10 and 11, 12. You just feel okay. So that's why that is for thalassemia. It's not, that doesn't
Apply
work
to
in sickle
the
cell
sickle
disease.
cell. Got it. The real deal. I got you. Um, do you know where I can find more information on sickle cell beta thalassemia plus? My daughter is 2 now. She's had one crisis so far, and that came from a virus. Her hemoglobin sits at 10.3 to 10.9. And so, what I'll just start off by saying is, you have a hematologist, the sickle cell expert should know the range of genotypes. And so, they should be able to care and educate you on sickle beta plus. But Dr. Q, outside of, you know, um, education around sickle cell, what do you feel people with beta plus specifically need to know outside of like, sickle cell, general information about sickle cell?
I think, like we talked about with siblings, there are things that affect your sickle cell disease that aren't hemoglobin S. They're not your hemoglobin level. And some people with sickle cell disease do better depending on what those things are. People with S beta plus thalassemia can't forget that they have sickle cell disease. I mean, they may not have any symptoms now, especially as children, but as they get older, if they don't take care of their health, and they don't kind of monitor it with a sickle cell center or sickle cell doctor, they could end up having problems because, as we've been saying, a lot of things that happen with sickle cell, you don't know they're happening, they're just happening. And depending on what type of, what the thalassemia is and what your level of hemoglobin is and some other things, your people with S beta plus thalassemia can really have problems. I had a young kid who, before he was a teenager, had bilateral avascular necrosis. Now, there's got to be some, which we never figured out, but there has to be some reason why he had had such bad bone disease. But it you need to, you can't walk away from medical care because your child or you have S beta plus thal and you think you're going to do okay. You still have to monitor it to make sure that, like we're like things are still what you think they are, which is good.
Yeah, that's a good question. And, in terms of getting information, I would say you can follow the information that is being provided as sickle cell as a whole. I know there's a lot of emphasis on, genotypes, and that's why I asked Dr. Q if there's anything specific to sickle beta thalassemia plus that you need to know. But I, and this might be a personal thing, and let me know if you disagree with me, Dr. Q. Um, I would first of all, I'd focus on how sickle cell presents in your child rather than the genotype. And so if your child has sickle beta plus, right, but you're seeing um, complications that people with SS have, that's still, a thing. That still can be a thing, or that's more common in SS. That still can be a thing in sickle beta plus. And so all information about sickle cell I would feel would be applicable to sickle beta plus. So I hopefully that makes sense. Like any information presented about sickle cell, um, and a lot of it is presented with an SS lens, right? Um, and SS is considered to be the most severe, right? I would go by that, like t making sure you know about all of that, even though sickle beta plus is milder, right? But quote unquote milder. Hopefully that makes sense. Hopefully I articulated that well enough you can piece that together. But as of resources specifically for beta plus, there I haven't seen any particular. I think all sickle cell disorders are kind of grouped together, right? And then you take what you can from, whatever that information and you apply it to you. And that's why I really push for individualized care instead of care based off of genotype because somebody in the textbook, a textbook may say someone with SS should be more severe, right? And that means getting acute chest in the hospital often, and just having a high disease burden. But somebody with beta plus thal could equally have that same experience. So I wouldn't focus too much on the beta plus and just focus on sickle cell and understanding your child's health.
And I think parents really need to educate themselves because if you don't know what the complications of sickle cell are or what to look for, you could miss something. And really you know your child better than anybody, better than
Yeah.
any doctor or anyone else, and you're with them all the time. So um, you need to know enough about sickle cell disease so that you can pick up problems early in your child.
Um,
Oh, we have viewers and questions on YouTube. Did you see that one?
oh my gosh, YouTube. I'm so sorry. I get so wrapped up in Instagram here. I am so sorry. I'm going to type everything down and listen. Forgive me for that. Um, there is a question about alcohol, and I wanted to wrap up with that question. Um, and maybe if you have time, a question from YouTube, Dr. Q, is that
Sure.
okay?
Yeah,
I'm
yeah.
so sorry,
I
guys.
have lots of time. I'm
Okay,
retired. I don't have
okay.
anything to do.
He's retired, but he's busy. Don't let that fool you.
So
Um,
alcohol
alcohol. And the
has a
question
lot of
is
problems
here.
associated with it.
The question is, I have sickle cell SC, and I've had multiple crises back to back as a kid. I'm now 20, about to be 21. Can sickle cell patients over 21 drink alcohol? If so, what brands? If not, why? So I don't think we could ever tell you about the brands.
Well,
Um,
nowadays I like Guinness beer, and now they have non-alcoholic beer. So that's something that you should think about if you want to drink alcohol after you're 21, is just order a non-alcoholic drink. The thing with alcohol is it dehydrates you. So if you're not a drinker, then you don't know it. But if you drink, you pee a lot, and so you can get dehydrated. And when you get dehydrated with sickle cell disease, then you can start having problems. Um, and and just overall, alcohol is not very good for your liver. Um, it's not very, you do things that you probably wouldn't do if you weren't drinking. And if you have sickle cell disease, some of those things wouldn't be a good idea. So alcohol overall is not a great thing to be doing very much of. And it can exacerbate your sickle cell disease. And if the people used to say, oh yeah, red wine is really good for you, but now people are kind of backing off on that and saying alcohol, just generally speaking, for your health is not so great.
and
So,
that's just for somebody without any health
yeah,
condition.
without sickle cell. So,
So, y'all, I love to turn up once in a while, and I think everything in moderation, right?
yeah,
Um, it's not to say you can't have alcohol. It's just do this with sickle cell in mind, right?
yeah.
Dehydration is a trigger to crisis. And so if you are having a shot, which is what I like to do, drinking tons of water. Was that TMI?
And it
I don't
flushes
like
out
I
the
don't like the
alcohol too.
cocktails. I
There you
don't like
go.
because the cocktails that the sugar it gives me headaches and stuff. I just like take the shot and move on with my life, right? Um and so I'm saying I drink once in a while. Like if it's a birthday, if it's this, you know. And I really feel like the new generation, I think I've read statistics or like Gen Z, their levels of consumption of alcohol is going down because they're like, we
Yeah,
don't want that, you know, ruining our health. And so, you know, information is power, right? But I have read studies that alcohol is a carcinogenic or carcinogen.
yeah.
And so, you know, causes cancer, all alcohol. And so if that's something that's risky for a person without sickle cell, a healthy person, then I would think twice. And you know, I feel like my answer to this question has changed all throughout the years. Like I feel like when I was closer to 20, I was like, yeah, yeah, yeah. Yeah, like live your life, and still live your life, right? But just think also, you know, with sickle cell, you have to take that extra step, right? And think about how this can impact you. Is a drink worth potentially going to the hospital, going to the ER, right? And, you know, just thinking about that stuff a lot more. So,
The other thing is after you have one drink and you're with people who are drinking, you're going to have another one, and then before you know it, you're in trouble.
so yeah, I don't ever feel like a doctor would say, yes, drink, right?
No.
Um, But, you know, it's you know, obviously everything is to your discretion, right? And just be smart about it at the end of the day. And we're very, very smart people. So, um, just yeah.
Somebody wrote the older you get, the more responsible you become. No, the older you get, the more kind of paranoid you get. Like, is this gonna
Yes.
be good for my health or bad for my health?
Yes.
You know,
Yes.
when you're young, you're healthy, relatively speaking, but as you get older, things change, and that's why there's three laughing emojis after that.
Yeah, things change. So, like, listen, take my advice if you're younger and asking these questions, like, you know, some of us gotta learn the hard way, but you don't have to learn the hard way.
No.
Um, or learn the hard way, whichever, you know, because I feel like I would have never listened to anybody and I would just experience it and learn it for myself, which is a bad way to learn things, but that's how I work.
Yeah.
Um, I see high smalls. Here we go. What impacts hemoglobin the most? Apparently, last month my hemoglobin hit 12 for the first time in my life. Plus, it disqualified me for a clinical trial I was asked to do. I'm so confused, plus mad. So, what impacts hemoglobin the most?
Um, well, I guess the most common thing that could change your hemoglobin is your hydration status. So if your hemoglobin's always running 9,999, you don't change anything, but you run for a mile or something, or exercise, play some basketball, and you don't drink any water, your hemoglobin's going to go up a little bit. So probably the thing that's going to change your hemoglobin acutely uh, would be that you get dehydrated, your hemoglobin goes up a little bit. I don't know if it wouldn't change dramatically probably, but it would definitely go up. And that's one of the things that doctors look at is when a patient comes in with sickle cell and their hemoglobin's 10, you kind of say, well, have you been drinking? Are you, do you, and you look at their lab, you can tell whether they're dehydrated or not. But that's the one thing that would do that. Acutely, I'm besides that, I can't think of anything that would increase your hemoglobin to 12 if it was 9 all the time. Um, so that's a good question. I really don't know, but hemoglobin of 12 for sickle cell is pretty high, actually.
Yeah.
Huh.
All right. Ooh, guys, these questions coming in here. I just want to quickly answer. It's can somebody with sickle cell have kids? Yes, I have a daughter. She is 10 years old. Um, so yes, people with sickle cell can have kids. It really is just being informed about your health and understanding the risks associated with pregnancy and complications with pregnancy, pain in pregnancy. Yeah, it's a lot to think about. But yes, but don't take that lightly, right? Don't take become parenthood and pregnancy lightly. But I just want to quickly answer that because a lot of people.
Yeah, and pregnancy for women with sickle cell disease is a high risk proposition, and you should have high risk OBGYN. You should have specialists who deal with high risk pregnancies, not just your regular GYN that you might be seeing all the time.
All right. Drum roll for the last question.
Is this from YouTube?
It's not from YouTube. That last question was from YouTube.
Oh,
Yes.
good. Okay.
Okay. My doctor recently took away my right to receive IV meds when I go to the ER for a sickle cell crisis. Is that even legal?
Uh, yeah, I mean, there's no legality involved in that. I mean, I'm trying to run that through my little brain to see what I think about that. Um, that's kind of an odd, I don't know what the situation is, but if you go to the ED and you're taking oral medications, I mean, you could be doing that at home, right? Although when you go to the ED, you can get hydrated with an IV. Makes that is very important. Um, and if they're giving you higher doses of oral medication, or they're giving you, you can have intranasal fentanyl. Some people do that to initially to get the pain down and then do something else. I'm not sure there, when you take opioids, whether you take it orally, it takes longer to work, but you're still taking opioids. So whether you get it through the IV or orally, the only difference is that it takes longer to work if you're taking it orally. So you might have a conversation with your physician and saying, well, maybe I should get my first dose IV, and that will bring the pain down. And then after that, maybe if you could have oral, but oral pain meds takes a while to work, as everybody who has sickle cell knows.
And yeah, and we don't have a while. That's just my thought. But we don't know your circumstance and what led to that. So it's a hard question to answer. Um, but generally speaking, I think a lot of us here, at least here in the US, have access to pain meds at home. And so if we do go to the ER, it is to get IV medication and to get relief fast. And so to me, and what do I know, right, guys? But to me, that sounds counterproductive to not allow for IV pain meds for sickle cell. Again, I don't know what situation. Maybe you react badly to it, right? And that's the reason why they said no IV medications, or maybe we don't know what happened in your situation to be able to answer that. But I know if I'm going to the ER, I've done everything I can at home to try and manage my pain and nothing works, then and I go to the ER, I definitely want to have access to IV medications immediately because I've been in pain for so long. And I would definitely feel that that would be my right as a patient is to get relief within the ER for my sickle cell pain crisis.
So
So,
the other thing is what everybody with sickle cell should think about is having a pain plan that you and the doctor agree upon. So before you get sick and you're having pain, you need to have some kind of understanding between you and your doctor in terms of this is the way we're going to treat your pain when you go to the emergency room. And you really have to well, not sort of, you have to agree with that. You have to agree that that's a reasonable plan for you. And it may be, I want 2 doses of IV meds, within a certain amount of time, and then I'll try something oral if that's what you want to do. Um, or you can just set it up so that, and the thing is, which doctors don't always understand, is that you know your pain better than anybody. So you know what works for you. I don't know what works for you. Your doctor doesn't have the pain, but you know what works, and then you have to come um, to an agreement in writing. This is my pain plan. I agree with it. My doctor agrees with it. Take it to the ED, and then that's what they do. And then if they don't, for whatever reason, they don't agree with that, then they could call your doctor and talk about it with their physician.
yeah.
But
So
you
the
do need to have a pain plan that you
yeah.
agree on.
Yeah, the best way I feel like I can be supportive in that question is, making sure that you do have a pain plan that you've discussed with your sickle cell specialist. Um, and if there is friction, or I also want to say if there is friction with your sickle cell specialist and you all aren't seeing eye to eye, then maybe it's time to look for another specialist as well. So I want to just say that as well. If that provider isn't supporting you in the way you want to be supported, then it might not be a match, and that's a real thing. Like there's a fit. Like me and Dr. Q, we work. We're great together, right? And there's a sort of chemistry, right? And we understand each other and so on, and can have that conversation. And I realize that might not be the relationship all the time. And so you want to find that person who truly advocates on your behalf, and who listens and is willing to understand where you're coming from. And so there's also that too. So pain plan first and see if that resolves that issue. And if it doesn't, then maybe start looking for another provider as well. Yeah.
And I think in your own mind, you have to decide you've been through this so many times, you kind of get an idea of what you think would work for you. And then you just have to agree with that. You have to get your provider to agree with that. And like Cassandra said, if it's really if you feel like it's unfair or this isn't going to work for me, then you have to get a referral to someone else.
All right, that was our last question. I'm so sorry I neglected you too, but I'll be better about that. And Dr. Q, do you want to say your statement before we sign off?
Oh, yes. So here at Sickle Cell 101, we're all about education and, uh, you know, knowledge is power. So what we're trying to do is help you understand your sickle cell disease and sickle cell disease in general. I'm not advocating any particular kind of treatment for anybody. We're not uh, we're giving only advice. This isn't something that you should take as a message from a doctor. You should always go to your own personal provider um, for information because they know more about you than anyone, and you should have a good relationship with them so you can get questions answered. But if you do have questions, you can always write to me at ask at Sickle Cell 101, and I will write you an answer.
And that's ask at sc101.org.
Yeah.
If you didn't get your question answered today, and Dr. Q really goes hard for any type of email questions because he can provide sources and receipts and you can nerd out with him on that. So, thank you so much for joining us today. A lot
Yeah,
of
thanks a
wonderful
lot.
questions. I always enjoy the conversation with you all, and we will be back in 2 weeks. And what else? It's getting hot, so please stay hydrated. Please stay hydrated, and be mindful of that. And happy Friday. Enjoy your weekend ahead.
Stay safe.
All right, guys. Bye.
Bye-bye.
And let me say bye on YouTube. Bye, YouTube. I'm so sorry.